Alberto. The BAFF receptor inhibitor Ianalumab is certainly one that comes to mind. Ianalumab is an agent that was shown in the VAHIT-3 study, as previously presented at medical congresses, to be effective in treatment of patients with third line and later ITP, and has there are two large phase 3 studies of Ianalumab to discuss. The VAHIT-2 study, which is evaluating Ianalumab plus L-Trombopag or placebo plus L-Trombopag in patients with true second-line ITP after failure of steroids. And that study completed, and there was a top-line press release demonstrating that study was a positive study. And then there's the VAHIT-1 study, which is similar to VAHIT-2, except in true first-line ITP, and Ianalumab or placebo is given in combination with corticosteroids. So this is a huge development program for a drug in ITP, and I think really promising, not just for the treatment of kind of later-line patients, as VAHIT-3 has shown us, but also potentially as a disease-modifying drug earlier in the course of disease, as VAHIT-2 and VAHIT-1 could very well show us. And so I think that is a different way of treating ITP and incorporating combination therapy. Unfortunately, the subcutaneous phase 3 study was not a positive study, but there is now another phase 3 study called Advance Next that is ongoing with IV Efgartigimod and ITP, and that could also represent a treatment option with a lot of promise, given that it affects the neonatal Fc receptor, which is responsible for the physiologic half-life of IgG, and knocking down that receptor will help get rid of the platelet autoantibodies that are troublesome. There's a few other therapies to talk about. There's Povetacicept, which is a BAFF-APRIL antagonist. That is currently in a basket study in ITP. There are anti-CD38 monoclonal antibodies, particularly Mezagitamab, and Mezagitamab just had a very nice positive phase 2 study that was presented, and this drug had very high response rates even in very relapsed refractory patients, and it targets those long-lived plasma cells that we know cause so much trouble in this disease. So, I think that there are a lot of really promising drugs on the horizon for ITP, and we're at the beginning of that sort of third era of ITP treatment, which is really going to be focused more on these targeted therapies.